Hi, this is Kordell Norton. This week in the Norton household, we're putting up curtains. They're going to be awesome. Curtains in the kitchen. But to put up curtains, you have to use the right tool. See, this is the modern way to put up curtains. This is the old-fashioned way to put up curtains. New, old, new, old. Well, here's the issue. When you go to build things, when you go to do things, you have to look at your tools. Because when your only tool is a hammer, all problems look like nails. Recently, I had a talk with Nathan Levantan, who is the head of the Seidman Cancer Center at the University of Hospitals. And we were talking about the cancer process that he deals with on a daily basis. See, when you have a doctor, doctors tend to focus on the area that they have expertise in. And so if you're a surgeon, you want to operate. If you're a radiologist, you want to radiate things, right? We're back to this hammer, only tool, all problems look like nails. So what he did instead is he took his team and all his guys, and he put them on teams. And so he has a team that has a radiologist, a team that has a surgeon on it, a team that has a chemotherapy guy, and each of these team members brings their area of expertise to the table. So the patient's cases are brought in, the team looks at it and discusses because there's several ways to skin the cat, right? Multiple ways to cure these cancers. And so these teams then look and say, let's give them the best treatment for their team. What a novel idea to get away from the egotistical focus of somebody who just has one tool. It reminded me of Terry Bradshaw of the Pittsburgh Steelers. He said that he was playing in the Super Bowl, and one of his players came up and said, Terry, I'm open on the short flat. Throw me a pass. And he said, I'm not throwing you a pass. When your arm is a howitzer, you don't throw short passes, you throw the long ball. Well, that's kind of where we're at with doctors. They have to learn how to work in teams. And so the question is asked, what is your team doing to work together? Are they working as individuals, or are they playing off of each other's strengths? Do you have processes in place to make sure that the best that the team has to offer is brought to meet the needs, the individual needs of the customer, in this case, the patient? And so I'm Kordell Norton. Focus on those teams, because one plus one equals 5. That synergy you can get from teams is awesome. And so this is Kordell Norton. Life is an experience. You need to be changing your now to wow. Now go make it happen.